that can be really helpful before you're doing some pelvic floor release work is actually some essentially manual release using a foam roller. You can use a yoga tune-up ball, and essentially I'm kind of foam rolling that space kind of right between the anus and the sits bone. So kind of if I grab my butt cheek, kind of right in there. So essentially that's that space that we want to breathe into when we're breathing into our posterior pelvic floor, or when we're sitting into a hip shift and we're trying to sense the right and left sides of our pelvic floor. But sometimes if things are really tight, it can feel great to kind of just get some manual work. Obviously, I'm not a pelvic floor PT, so this is something that I can recommend as a coach, is just kind of foam rolling that side. I'm not just sitting here foam rolling my vagina area. It's more of that kind of right on the side. So that space, like I said, between the anus and the sits bone, and I might find like a tight restricted spot, and I'm just gonna think about holding and breathing for about 5 breaths and kind of feeling that tightness. And then I might go to some of my posterior pelvic floor release drills, my hip shifting, and see if giving that visualization of where the tightness is helps you sense that air and pressure flow and allow you to kind of feel the sits bones spread apart and just feel like you can sense where that space is. It can be a great just visual of like, oh yeah, that's really tight. Okay, that's where I want to breathe into. So give that a shot. Like I said, you can grab, you're just essentially rocking back and forth. Don't hang out in the middle on your vagina, but kind of go to the side and just kind of rock there. You'll find a tight spot, hang there for about 3 to 5 breaths, and then you'll go to the other side. That's my left, that feels pretty tight, and just hang there for 3 to 5 breaths. You can use the foam roller or you can use one of those squishy balls.